Informed consent is a crucial aspect. In India, it is said that if you take care of documentation, counseling, and consent, 50% of litigations can be avoided against doctors. In India, as in many other countries, informed consent is a crucial aspect of medical practice that helps to protect both patients and doctors. Obtaining informed consent can help prevent litigation by ensuring that patients understand the risk, benefits, and alternatives to medical procedure or treatment. To minimize the risk of litigations in India, I will tell you 10 solid preventive measures that doctors should consider when obtaining informed consent from patient. Clear communication. In four walls of the medical college, the doctors are not taught the soft skills. Now lately there has been emphasis on it. Doctors should communicate in a language and manner that the patient can understand, avoid using medical jargon, and ensure that the patient comprehends the proposed treatment or procedure. It's very important that person understands you fully. Detailed information. Provide a comprehensive explanation of the diagnosis, recommended treatment, potential risk, benefits, and alternative. Use written material if necessary to make them understand. Time and space. Allocate adequate time for patients to consider their options and ask questions. Rushing the consent process can lead to misunderstanding. They must be asked time and again कि आपको समझ आ गया कि नहीं. Patient questions. Encourage patients to ask questions and address them thoroughly. Document all discussions and questions in the patient medical record as well. Consent form. There is one flat consent. The second is procedure-specific consent. Use standardized consent forms that clearly outline the procedure-specific is risk and alternatives. Ensure that both the doctor and the patient or their representative sign and date the form. Patient consent is very important, not the relative consent. Witnesses. If possible, have a witness present during the consent process to attest that it was conducted appropriately. It's very important. Patient volition. Ensure that the patient is providing consent voluntarily without any undue pressure. Verify that the patient is competent to provide consent. Exploring alternatives. Discuss alternative treatment options and their risk and benefits. It may be possible that you may not be doing an alternative treatment. Document the patient's choice if they opt for a different treatment than the one recommended by you. In emergency situations, when the patient is anesthetized and not been able to give the consent, in that case, the patient's relative consent can be taken. Two doctors of the same institution also can sign, and this is for life-saving measure. Document the emergency circumstances and the reasons for surrogate decisions. Now, lately in 2023, National Medical Council has given an option that prior to the surgery, take a consent from the patient. When I'm anesthetized, so and so can give surrogate consent for me. Hope this gets verified and we start using it. Follow-up documentation. Maintain detailed records of the informed consent processes, including discussions, questions, and the changes of the patient decision. Accurate documentation is crucial for legal protection. Here, I just wish to again remind you that the consent has to be taken by the patient. Secondly, जितनी consent ली है उतना ही काम करना है. If you have taken the patient for ovarian cyst removal, you can't remove the uterus. जितनी consent ली उतना ही काम करना है. And in emergency situations, the relatives can give consent, two doctors can give consent in the good faith to save the life of the patient. Medical negligence cases in India are complex and can vary based on specific circumstances. It's essential for doctors to consult with legal experts and their professional associations to ensure that they are following best practices in obtaining informed consent and mitigating the risk of litigation. Additionally, adhering to medical ethics and maintaining open communication with patients and patients' relatives can go a long way in preventing disputes and litigations against doctors. Thank you very much.